As part of peripheral nervous system disorders, we have been discussing neuropathy of a few cranial nerves, glossopharyngeal, trigeminal, for example. Now we are going to talk about the spinal nerves, where we specifically talk about brachial plexus neuropathy. You know, the formation of brachial plexus is from the cranial nerves C5, C6, C7, C8, and T1. Okay, and the plexus gives rise to 5 different nerves, ultimately, all of which simply serve the arm. The entire arm is supplied by the nerves from the brachial plexus. Okay, so neuropathy is where there is inflammation of the plexus or the nerves that shoot off the plexus. Okay, what causes neuritis? Neuritis is inflammation of the nerves within the brachial plexus. The cause is unknown, so it's idiopathic. Okay, it's also called a shoulder-Gordon syndrome or Parsonage-Turner syndrome. Okay, acute onset of severe pain in the upper arm. So you know the location and its distribution. So it's usually in the upper arm and in the shoulder area. Okay, secondary cause, that is something other than the plexus itself, is where trauma could be one that affects the brachial plexus. Dystocia, that is, at the time of birth, if the shoulder was caught and then pulled, that could be another cause of this neuropathy. All right. Like most other neuropathies we have discussed, the brachial plexus neuropathy is associated with inflammation and immune response. All right. Autoimmune neuropathy is also possible and is due to some sort of dormant virus that is in the nerve root and then gets activated at some point and then cause neuropathy. Okay, so it could be an autoimmune disease, it could be an inflammation due to many reasons, trauma, or the viral activation, and so on. So pain is typically severe at the onset of neuropathy, but then gradually it goes away. Okay, there may be paralysis of the skeletal muscle. Paresis is partial paralysis, and then the skeletal muscle wasting, and that's where that may include the diaphragm. Okay, sensory disturbances are typically not as much as the skeletal muscle involvement, and even if sensory disturbances occur, they again fade away. They go away over time, and exercise and pregnancy also may exaggerate brachial plexus neuropathy. Okay, that is where you're talking about hormones like progesterone during pregnancy, and exercise is where sympathetic activation is another reason for the activation of neuropathy. Okay, so very general, nothing significant here. Neuropathy, immune system inflammation, and motor system being affected, the arm shoulder area being affected. Those are the key details to think about here. Okay, thank you.